this is G.H. Glade for Coaching ADD and the Stimulus-Driven Brain. Well, we're all sort of living in this Orwellian fever dream that is the COVID virus crisis. And anxiety has been a real theme running through the course of this for my clients and whatnot. And one client in particular is a young woman who's a businesswoman. She's just starting her own business. She's smart, she's kind, she works with kids, and she's got it on the ball, and she's experiencing panic. And the takeaway is, if it can happen to her, it can happen to you. Now, there's a link between ADD and anxiety. And we find that anxiety is one of the really common conditions that affects people with ADD. It's really about 50% of adults and actually 30% of kids with ADD that have a comorbid anxiety disorder. And as we learn more about these, we tend to find more of this connection. If you have ADD, sometimes it's hard to recognize if you actually have anxiety. You know, one of the manifestations of the comorbidity is hyperactivity, lack of attention, difficulty with impulse control, fidgeting, trouble sitting still, and difficulty organizing. This sounds a whole bunch like ADD, and in the reality, this can be symptoms of an anxiety disorder. The interesting thing is when I treat ADD, many times anxiety goes down. It takes out the trigger of all those thought sets that are around performance. Suddenly a person is able to focus and perform. So in this video, we're going to talk about management of anxiety and management of its bigger, worse cousin, panic disorder. Now, the young woman I referred to basically has had occasional panic episodes. And yeah, of course, who wouldn't? I mean, she's just starting a new business. All of a sudden, everything's closed up. And, it just, it's not a good situation. So what happens during a panic attack? And this is when the body goes into fight-flight reaction in a real sense of hyperactivity. People can have rapid heart rate. They can actually have heart palpitations. Oftentimes they feel short of breath or like you're smothering. Sometimes you get vertigo, that sensation like the room is just spinning around you. And other times you get a little sick to your stomach. Many people feel like they're having a heart attack. And the problem with a panic attack is the escalating panic confirms the symptoms that you worry about. Now, there's two interesting thought sets that happen with a panic attack. People feel like they're going crazy. And on one level, it does feel like that for people. The other thought is that they're going to die. And sometimes they have both of these. Now, what happens when we have this, it will last intensely and seem like it comes out of nowhere and just boom, it's on you. But there's always triggering. So let's take anxiety apart and talk about ways of intervention. Anxiety is best managed first at low level. There's a real analogy to pain. You want to manage anxiety at the lowest level so it doesn't build. And when we come to medications for that, the first class of primary care particularly tends to jump to are benzodiazepines. These are your Xanax, which is a fairly horrible drug in many ways, Ativan, and clonazepam. The longer-acting one is Valium. These, as a class, and class is benzodiazepine, are remarkably like alcohol in their receptor system affinity. So they are good as a short-term intervention. But like alcohol, we'll get used to them if we take them regularly. And then, like alcohol, we will become dependent on them if we're using them at a consistent rate, and as the levels grow, because with alcohol, we get used to the effect. It's called habituation. Same thing happens with the benzodiazepines. And the analogy with pain is very good, because you never want to use an acute medication for a chronic situation. But in the acute situation of panic, short-term use of benzodiazepines is pretty darn appropriate. The recommended course, if a person has ongoing anxiety problems, and I always like to treat the ADD first, because a lot of times that erases a lot of the anxiety, are the SSRI antidepressants. These things have a side effect profile, which you can talk with your healthcare provider more about. But these have been the first-line intervention for all the anxiety disorders for 30 years. I've stopped going to the anxiety disorder conference because it's the same thing. Behavioral techniques with cognitive behavioral and SSRIs. So hopefully one doesn't need to do that. I'm going to talk about something I learned in the military in terms of an interruption technique when anxiety is getting to a peak. It is something called box breathing. Box breathing is really a pretty simple technique. You breathe in slowly through your nose, you hold, you breathe out through your mouth, you hold. You breathe in again and hold, and out and hold. And you want to do it for about maybe 3 seconds to start with. Gradually increase the duration so the box gets bigger. Now, what I want you to notice is how you get a sense of calm, particularly in your chest when you're on the hold. Reflect on this for a minute. I'm going to suggest you also hit pause and you try this a couple of times yourself, because it's a really easy technique. And it's important to practice this particular technique. You'll find it is a very good interruption technique. It's also something good to use for spot anxiety, like say you're beginning to give a public talk or something. I really have used this technique pretty extensively. So I want you to imagine the job of a sniper. They have to make very fine motor movements while people are shooting at them. What a scenario for anxiety to happen. And all the elite forces get taught box breathing. Now, box breathing is a really good interruption technique. Techniques for ongoing management, meditation is great for that, but we want to eventually get into that cognitive disruption. Thinking first and foremost about what are your triggers, and then helping a person lean into those triggers. And oftentimes a few sessions with a therapist can be really helpful with this. I advise people in terms of anxiety to lean into the problem. And let me explain what I mean by this. Let's take the example of agoraphobia, people who are panicked and afraid of going out of their house. Well, the process is like this. Anxiety starts escalating as they have all these fears about what might happen if they go out. And they approach the door, anxiety gets higher, and they just say, no, I'm not going to go out. They back off, and anxiety goes down. And it reinforces that whole process where avoidance of feeling as awful as anxiety feels is supported by backing away from it. This also goes with the cognitive challenge aspect of this. Now, ADD and anxiety, they go hand in hand. Half of adults with ADD have it. And oftentimes this is short-term work you can do with either your healthcare provider or a few sessions with a skilled therapist, which, I'm an advocate of people doing that, taking control of that anxiety. And so we're going to draw this to a close. You've heard a little bit about meds, a little bit about behavioral interventions and whatnot. Stay safe. Now, if you like this video, please hit a like. Please also share it with others because, as we live through this Orwellian fever dream that is the COVID crisis, there's a lot of anxiety out there. Until next time, this is G.H. Glade for Coaching ADD and the Stimulus-Driven Brain. Take care.